Just in the interest of time, we're just going to move on to our last speaker. So it's my pleasure to introduce Preet Lally. She's an undergrad co-op student in biology, I understand, working with HiRO and has an interest in genetics. She's engaged in a project looking at the impact of genetic counsellors and an integrated multidisciplinary team in the efficacy of cascade screening in HiRO. Preet, thanks for joining us, and I'll pass things over to you.
Yeah, happy to be here. Thank you so much for the introduction. I'm just going to share my screen quickly. Are you able to see the slideshow? Perfect. Thank you.
Yes.
So yeah, thank you all for the introduction, and I'm very honored to join everyone today following some very exciting and interesting presentations. And it's always very, I guess, special and important to see where the future of cardiogenetics is headed. So my name is Preet Lally, as was mentioned. I'm with the HiRO coordinating site, Vancouver site at St. Paul's Hospital. And my project is looking at the efficacy of cascade screening through an analysis of genetic counselor integration across National HiRO Sites. So yeah, I'll start briefly with an introduction of myself as well as the project. So my name is Preet. I'm a fourth year undergraduate student, as was mentioned, in the Department of Biology, and I do have an interest specifically in genetics within that field. I'm currently on my second co-op term as a research assistant for HiRO's Vancouver site. So I started in September, and a lot of my day-to-day involves enrolling patients into the National HiRO Registry, as well as a few other studies that I've been working on. I'm personally interested in pursuing medical genetics or genetic counseling following completion of my Bachelor of Science. So this has kind of led to where my interest for this project comes into play. I find that genetic counseling is a profession that might not be well known outside of kind of the niche field of genetics, especially in the space of cardiogenetics. We're all quite familiar with genetic counselors, but that's not something necessarily the whole general public might be familiar with unless they've had some kind of exposure to a genetic condition. So this project is meant to allow a greater understanding of the role that genetic counselors would play in terms of diagnosis and treatment of patients that are being seen for inherited heart conditions, so at our varying HiRO sites across Canada. So specifically, I'm interested in studying the uptake and cascade screening of first-degree relatives in relation to how genetic counselors are integrated within the various HiRO sites. So the hypothesis for this study would be that a multidisciplinary approach that has full integration of genetic counselors would be better for families, ultimately to improve the efficacy of cascade screening, as well as catching more potentially affected family members. And I'd also like to thank Dr. Kran, as well as Simran Dio, who is our research coordinator at the site, and Amy Ho, who is a genetic counselor here, for their help and support in this project. Their experience and expertise has allowed me to take this on, and I'm very excited to see where it goes. So I'll give a bit more of a background about what the project is kind of aimed to look at. So again, we're looking at levels of genetic counselor integration across HiRO sites. So for the purpose of this project, genetic counselor integration would be described as kind of how the setup of each HiRO clinic would involve genetic counselors, if applicable. So not every HiRO site necessarily has genetic counselors that are fully staffed or present during the regular clinic days, but we would be looking at how genetic counselors might collaborate with other clinicians in terms of their role in diagnosis and treatment of the patients, how they might be in contact with patients and relatives for genetic testing. So we're hoping to quantify the details of genetic counselor integration by categorizing the sites into 3 different levels of integration. And we'll look at this in comparison to how likely it is that cascade screening takes place when it is required. So for example, if a proband is eligible for genetic testing, was the family screened? Is that something that was brought into consideration? And how are genetic counselors involved throughout this process? So next steps of this study would include sending out brief questionnaires to the various HiRO sites in order to determine what level of integration they fall under. So as I mentioned, there are kind of 3 levels of classification that we are looking at so far, which would be fully integrated, partially integrated, and not integrated. I'll give a brief gist of what these different definitions would look like so far. So for a fully integrated site, we'd expect that genetic counselors would be staffed at the clinic, so either full-time or part-time, and working side by side along other clinical staff. So for example, the physicians that are on site or the nurses, whatever other team is in place. And genetic counselors would be very involved in discussing the patient's care as well as treatment options, from everything to, how to proceed with their treatment, as well as whether genetic testing is appropriate given a certain case. On the other end of the spectrum, we would look at sites that might fall under the category of not integrated. So in this case, we might expect that a site does not have genetic counselors that are necessarily in staff or in clinic, but rather when a patient is eligible for genetic testing, the physician may choose to refer that externally. So for example, to a medical genetics specialist or genetic counselors that are external to HiRO. So that would be kind of what we're looking at in that category. And of course, partially integrated would kind of be a middle ground between the two extremes. So this might, for example, look like genetic counselors that are staffed by the HiRO site, but maybe not so involved in kind of learning all the details of patient care and being super involved with doctors. It might be instead that the physicians refer patients to the genetic counselors when appropriate, as opposed to genetic counselors and physicians working side by side directly. So yeah, these are kind of the brief details of the methodology that we plan to use to look at this project. And we do also anticipate further down the line looking at data from different sites that might be related to how likely it is for cascade screening to occur and the efficacy of cascade screening. So how efficient is it for when cascade screening does occur? Does it actually, catch these patients that family members that might also carry a certain gene that might be pathogenic or likely pathogenic or impact their health in a certain way? So yeah, we're kind of just looking at the role genetic counselors might have to play in all this. And basically what I have for now. Of course, this project is still kind of in the working stage. I'm very excited to hear if there's any feedback or questions about the project details. And for any HiRO research staff that is present, please keep an eye out for an email that would be coming your way with the details of the questionnaire that I'll be using to collect data for this project. So yeah, that's all from me. Thank you.
Thanks, Preet. That's fantastic. I think it's actually a really, just as feedback, I think it's a really great topic. Personally, for us here, we're having an ongoing discussion about how to bring a GC back into our clinic and having some data to kind of support how that translates into improvements in patient care is going to be really helpful, I think. So yeah, I think well done. Happy to help in any way. Next steps wise, what do we expect? Are you going to start reaching out to people?
Yeah, so as I mentioned, we're kind of looking to classify all of the HiRO sites into one of those three categories of how integrated genetic counselors are. So we would be doing that through the format of a questionnaire. So we'll probably be in contact via email or potentially set up Zoom meetings with each of the coordinators for every site. And then we'll have a discussion about where each site feels they fall kind of on that scale, if that makes sense.
Yeah, fantastic. Thank you.
I was kind of wondering as you were speaking, so were you thinking that the endpoints that you would be looking at in terms of to assess the outcomes, would that be in terms of I guess maybe more of an open question. What kind of endpoints were you considering as kind of metrics of the success of cascade screening? Did you have any kind of ideas as to how you would measure that?
Yeah, so I think we're considering, as I mentioned, pulling data from different sites. This might, again, this is kind of in the working stage, but this might involve looking at data for how often cascade screening occurs. So how many first-degree relatives of patients that are known to have maybe carriers of a certain variant. So how often those patients are also seen in clinic, how often their first-degree relatives are also seen in clinic or referred for genetic testing. And then maybe also looking at how often that genetic testing comes back as actually finding a variant of interest. So, was that the best treatment plan in that case? And of course, sometimes genetic testing comes back as negative, but that's also still helpful for patients and their families to know that certain family members may not be at risk. But yeah, those are some of the early stage ideas that we have.
Yeah. Yeah, it could be very challenging I can imagine it'd be very challenging to find a good metric there, because there's often a lot of water that passes under the bridge between the suggestion that a patient's first-degree relatives get screened and them actually turning up in a clinic either to have a genetic test or a clinical assessment. And I could well imagine that geography and finances and a whole bunch of other factors that could be specific to a site and potentially, be related to, whether or not that center has an integrated relationship with genetic counselling as well might factor into that. Lots of interesting potential interactions there.
Yeah, for sure. And that's actually something I found quite extensively through the early stage of literature reviews that I've been doing, is that a lot of times it's not a matter of do we think genetic testing is the right approach, but rather, patients might not always have close ties with their family members. There often are geographic barriers, as you mentioned. So there are loads of other reasons why patients might not be getting genetic testing for their family members, not necessarily because it's not considered the best treatment plan, but again, other barriers that are in the way. So definitely something we'll be taking into consideration through this project, I hope.
Thank you.
Yeah, I'll just add, last week I saw a patient in the device clinic who'd been followed by a community cardiologist with HCM for 30 years and has 2 children and 6 grandchildren. And the closest they got to anything was being told that their kids should get checked, and he thinks his kids might have had an echo 20 years ago. So, the next event that could happen will be the sudden death of his grandchild, right? So it's exactly this kind of thing where you would like to think that active efforts to try to improve cascade screening does involve processes, people, systems, reminders. It has to be in the middle of somebody's desk, and quite frankly, in most Canadian systems, that's a genetic counselor's responsibility drives this. So one of the questions is, can we measure that happening in HiRO, where we do have a network of most of the clinics in this realm? Our simple metric is actually probands, and then we have a family ID number that allows us to know how many of their first-degree relatives were enrolled. So that's a very crude place to start, but it is a start. And one of the things I get as the old guy is I get asked by a bunch of people, we don't have a genetic counselor, and we've been working with admin for the last 3 years trying to get budget support for assigning a genetic counselor. And I think the more local the data is to show that there's an impact, the more effective some of those arguments will be.
Yeah, absolutely. See, we're actually up to time, 7 o'clock. So are there any questions for Preet, anything else for any of the other speakers before we finish? Okay.
I just want to shout out that 3 people at various stages of their training have done a superb job of not only conducting but also presenting their interest in research. So I'm really impressed.
Absolutely. Second that as well. Well done, everybody. We wouldn't be here without you speaking, so thank you for your efforts and great job all around. Thank you to everybody who's attended. This has been recorded, so it will be available on the HiRO YouTube channel once it's been edited. But otherwise, thank you for attending and have a great evening.
Thank you.
Thanks, everyone.